Selective androgen receptor modulators, or SARMs, are a class of compounds designed to mimic the effects of anabolic steroids. They aim to promote muscle growth and fat loss, but with fewer side effects. However, SARMs are not without their own risks and side effects. These can vary depending on the specific compound used, the dosage, and the duration of use. Here are the most common and potential side effects of SARMs. Number 1. Hormonal imbalances. SARMs can suppress the body's natural production of testosterone, much like anabolic steroids. This suppression can lead to symptoms of low testosterone, such as reduced libido, erectile dysfunction, fatigue, and mood swings. In some cases, post-cycle therapy or PCT may be required to restore natural hormone levels. Additionally, some SARMs can cause mild estrogenic effects, leading to symptoms like water retention or gynecomastia, which is the development of breast tissue in men. Although SARMs are less likely to cause this than anabolic steroids, it is still a potential side effect. Number 2. Liver toxicity. Some SARMs, particularly those that are taken orally like ostarine and ligandrol, can put stress on the liver, leading to potential liver toxicity or damage. Elevated liver enzymes are a common sign of this, so liver health should be monitored during use. While SARMs are often marketed as liver-safe alternatives to steroids, some users have reported liver-related issues, especially with long-term use or high doses. Number 3. Cardiovascular issues. SARMs can affect cholesterol levels by increasing LDL, which is the bad cholesterol, and decreasing HDL, the good cholesterol. This imbalance could increase the risk of heart disease over time. Additionally, some SARMs can cause a mild increase in blood pressure, particularly when taken in higher doses, which may contribute to cardiovascular strain. Now let's talk about the psychological effects. Some users report experiencing mood swings, aggression, irritability, or increased anxiety when using SARMs, especially if the compound causes a significant suppression of natural testosterone levels. Additionally, after stopping SARMs, some users may experience a drop in mood or feelings of depression due to hormonal imbalances. Moving on to hair loss. SARMs may increase the risk of hair loss, particularly in individuals who are genetically predisposed to male pattern baldness. This is related to increased levels of dihydrotestosterone, or DHT, a hormone that contributes to hair loss in sensitive areas. Lastly, let's discuss the potential for dependency. Although SARMs are not as addictive as anabolic steroids, users may develop a psychological dependency on the performance-enhancing benefits they provide. This can lead to prolonged use, which increases the risk of side effects. While SARMs promote muscle growth, they don't necessarily strengthen tendons and ligaments at the same rate. This can lead to an imbalance where muscles become stronger, but connective tissues are more vulnerable to injury. Reproductive and sexual health are critical areas affected by SARMs. Prolonged use of SARMs can cause shrinkage of the testes, known as testicular atrophy, which is a common side effect of androgenic compounds. This can be reversed after discontinuing use, but it may require post-cycle therapy or PCT to help restore normal function. Additionally, some SARMs may impair sperm production, leading to temporary or even permanent infertility. Moving on to long-term health risks. The long-term effects of SARMs are not well understood due to the limited research available. While SARMs are marketed as safer alternatives to steroids, there is still concern about the lack of data regarding their long-term impact on health, especially regarding the liver, cardiovascular system, and hormonal regulation. Another significant issue is the risk of contaminated products. Many SARMs are sold through unregulated markets, meaning there is a significant risk of contamination, mislabeling, or adulteration. Some SARMs products may contain other substances, including anabolic steroids or other dangerous compounds, which could increase the risk of side effects or toxicity. In conclusion, while SARMs may offer benefits such as muscle growth, fat loss, and improved performance with fewer side effects than anabolic steroids, they still carry significant risks. These include hormonal imbalances, liver stress, cardiovascular issues, and psychological effects. Additionally, since SARMs are often sold in unregulated markets, the purity and dosage of the compounds may vary, further increasing the risk of adverse effects. For those considering SARMs, it's important to weigh the potential benefits against the risks and to be cautious of their unregulated status and long-term safety. If you're looking to enhance muscle growth or performance, safer alternatives like proper training, nutrition, and legal supplements are generally recommended.